was called the world's first pregnant man, and today he gave birth.
But the court has gone the whole way, said there is an absolute constitutional right to same-sex marriage.
Hurricane Harvey is pelting the Texas coastline.
There is an increasing attack on freedom of religion, speech, and comment.
Welcome to the Issachar Hour, examining law, policy, and culture through the lens of the Judeo-Christian worldview to help you understand the times and know what you ought to do.
Good day, good night, good evening, good morning, whatever part of the world you are in. Welcome to the Issachar Hour. My name is Wayne West, and this is my wife, Doreen. And yes, we are on the Issachar Hour today. And what are we going to be doing today?
We'll be discussing again the COVID pandemic. We'll be talking particularly about one place, which is my husband's favorite place to talk about, and that is Uttar Pradesh. We'll be looking at what happened in Uttar Pradesh and why.
Well, it's exciting because when you have a champion, and I consider the government of Uttar Pradesh to be a champion in managing the pandemic, I think it is something that should be spoken about. And unfortunately, it is something that, for whatever reason, is not a part of the mainstream media. When India had its calamity just before the summer 2021, all the international media were there. CNN, MSNBC, etc. were there saying how terrible things were.
Yes, and showing the bodies burning
on the Thames and all this sort of thing. As soon as the Indian states, my apologies, not the Ganges, not the Thames, the Ganges, yes. As soon as the Indian states got the pandemic under control and in a way that no other really territories or countries seem to have got it under control, those media houses disappeared. They do not. It's as though these Indian states no longer exist. But they have done wonderfully well in managing the pandemic, and we think that it's important for us to share what they have done with you so that you, the public, can have an idea of how these things can be approached and how a government can manage them in a manner that really causes little loss of life and loss of economic activity. But before we actually go into what they did, we're going to just give you a sort of perspective on why Uttar Pradesh is to be considered the champion in managing the COVID-19 pandemic. So we're going to
model of management.
Model for management. Why? What were their results and why they should be considered a model for management. So let's take a look at that. We're going to take a look at this video, the first video, in which we give you some data and where we compare Uttar Pradesh, the United States, the United Kingdom, Caribbean countries, Trinidad and Tobago, and Jamaica.
Just to be accurate, Uttar Pradesh is just one state in India.
It is a state in India, yes.
Whereas all the other places to which you're comparing it are countries.
That's true, but Uttar Pradesh has its own government. India has a federal system, so just as in the United States, so you have an overarching government, which is the federal government. But Uttar Pradesh, the government of Uttar Pradesh has the freedom to do things that the federal government may not want to do. So they are nonetheless a self-governing territory.
To a certain
extent, yes. So let's look at that data.
So why Uttar Pradesh? Well, Uttar Pradesh had outstanding success in managing the COVID-19 pandemic between July and December 2021. During that period of time, they had 0 deaths and average 8 and 9 new cases per day, and I think that was also the 7-day average, approximately 8 or 9 cases. Very few cases and no deaths for approximately 6 months. Even with the arrival of the Omicron variant, when cases increased almost exponentially worldwide, Uttar Pradesh maintained its excellent record. So let's take a look at Uttar Pradesh and compare it to some other places, other countries, other territories. Uttar Pradesh is an Indian state. And in fact, what we are saying about Uttar Pradesh applies to a number of other Indian states as well. But we're using Uttar Pradesh. I think they had the most outstanding example. So the population, Uttar Pradesh, is 240 million compared to the USA, 333 million compared to the United Kingdom, 68 million compared to Trinidad and Tobago, 1.4 million compared to Jamaica, 2.9 million. So on the 15th of January 2022, Uttar Pradesh had 12,447 new cases of COVID-19. The USA had 803,647 new cases. The UK had 116,189 new cases. Trinidad and Tobago, 576 new cases. And Jamaica, 1,313 new cases. Now, to compare these absolute numbers, we present a table now with the average, the 7-day average rate per million population. That's per million of population. And we see that Uttar Pradesh had 5 after 4 zeros. The USA, 2 zeros and then 2 4. The UK, 2 zeros and then 1 7. Trinidad and Tobago, 3 zeros and then a 4. Jamaica, 3 zeros and then 5. This is behind the decimal point. But we want to compare it to Uttar Pradesh because Uttar Pradesh is the gold standard. So when we compare this with Uttar Pradesh, of course, when we compare Uttar Pradesh with itself, it's 1. But the USA had 48 times the number of new cases on average during a 7-day period than Uttar Pradesh. The UK, 34 times more. Trinidad and Tobago, 8 times more. And Jamaica, 10 times more. When looking at the vaccinated, the fully vaccinated, the status of the fully vaccinated percentage of the population, in Uttar Pradesh, at that time, there were approximately 20% of the population was fully vaccinated. In the USA and the UK, more than 60% of the population were fully vaccinated. Trinidad and Tobago, approximately 47%, and Jamaica, just about 20%. Another important figure is the average number of deaths over a 7-day period. So the 7-day average for deaths in Uttar Pradesh, 4. Remember, this is a population of 240 million, 4. The United States, 1,961. The UK, 263. Trinidad and Tobago, 19. Trinidad and Tobago, 19. And Jamaica, 4. Now, when we compare these average, the 7-day average as a rate per million, and we compared Trinidad and Tobago, Jamaica, USA, UK compared to Uttar Pradesh, we see, of course, Uttar Pradesh compared to itself is 1, because it is a reference. The United States had 352 times the number of deaths on average over a 7-day period that Uttar Pradesh had. The UK had 232. Trinidad and Tobago had 814 times. Their 7-day average was 814 times that of the 7-day average for Uttar Pradesh. And Jamaica had a 7-day average deaths of that was 83 times that experienced in Uttar Pradesh. So we can see when we compare, bringing things to the same, compare the same rate, the number of new cases per million, the number of deaths per million, and we present that as an average over a period of 7 days. Uttar Pradesh shines like a star compared to all of these countries here, USA, UK, Trinidad and Tobago, and Jamaica. So it means that we really must consider and seek to find out what the government of Uttar Pradesh did to have such an excellent result in terms of their management of the COVID-19 pandemic.
Well, that was an interesting video showing comparison between the state of Uttar Pradesh in India and the Caribbean and large Western countries like UK and US. My first question, though, that one may ask is, are these data reliable? Are they credible? And where did you get them from anyway?
Okay, well, the data comes from Johns Hopkins University. Johns Hopkins is regarded as probably the premier, rated number one. It's an excellent center for epidemiology, Johns
So these
Hopkins
are published
University.
data?
And these are data published by Johns Hopkins University. So they are as credible as you get. I trust that they are in contact with the various agencies in these territories and are able to get the results from them. Now, it can be argued, for example, that in a state like Uttar Pradesh, the systems for gathering data may not be as good as those in the United States or the United Kingdom, and that's a reasonable consideration. But even if we had to multiply these figures by a factor of 10, in other words, if the people in Uttar Pradesh were not detected one in every 10, they're still doing a lot better than these other countries.
Okay, and the data from all the countries, including Jamaica, are from the same place.
Yes, they are all from the same place, Johns Hopkins University, they give a daily report on COVID-19 cases in all countries around the world. And it's easy, it's online, it's freely available. I chose the data for the 15th of January.
Yes, why that date?
Because that's when the Omicron's variant, about a month into the Omicron variant, which I think was first detected somewhere in December.
Okay.
So before that, Uttar Pradesh had
even better figures.
In fact, from July to December, they had 0 deaths, to the best of my recollection, and they were averaging just about 7 to 8.
So the January date reflects the impact of Omicron.
That's right, and that's why we wanted to show you that when it was challenged, and not only Omicron, Uttar Pradesh actually was having some election at that time as well, and certain religious festivals, so there was a lot of mixing and so on. So this is why we wanted to show what's happened there under those circumstances.
So these data are not from, like Jamaican data, are not from the Ministry of Health in Jamaica.
I think they would be. From the Ministry of Health.
That's where the publishers would have got the data from.
Yes, I believe they would be in contact.
Similarly from Trinidad and Tobago?
Yes, I think they would. The authorities. Yeah.
Okay, so they are probably sourced from the Ministries of Health or the CDC or whatever organization in each country that is responsible for collecting data.
Absolutely.
But they are collated by
Johns
Hopkins University. So they are as reliable and credible as the health gathering information in each country is, and as Johns Hopkins is in collating and producing them.
Absolutely.
Okay. Absolutely. All right. So we have looked at several stark differences between Uttar Pradesh and all the other places you mentioned here. Large countries as well as smaller Caribbean states. Do you want to just emphasize what are the main differences?
Well, as the chart and the little video showed, they were looking not simply at what was happening on a particular day, but on average over 7 days. So
7 days up to that day.
7 days up, so it should be average of 7 days up to the 15th of January, 2022. And then, in order to make sure that we are comparing like with like, the comparison was made between the number of cases over the average over the 7 days and the number of deaths average of this over the 7 days.
The daily average over the 7 days, previous 7 days.
That's right. Per million of population.
Million, because otherwise you can't compare numbers when one place has a population of 240 million,
Absolutely.
Another place has 1.4 million. It would be ridiculous to compare sheer numbers.
That's right.
And so they are comparing numbers per million population, which is a much more credible way of comparing.
Yeah, because you're looking at a rate. You're looking at a rate per million. We're not doing statistical analysis of the data that we have here, but we're looking at the occurrence.
Just looking at rates. You're just comparing rates.
Comparing rates.
We can talk about the reasons for these rates.
Yeah.
Okay. So what are the reasons? We're going to go into the reasons for the difference later on, but let me ask you first, why do you think these results that we got in Uttar Pradesh are repeatable in our countries? Aren't we different
why they ought
culturally?
to be
Why they ought to be? Aren't we different culturally in a lot of other ways? Aren't we different? So is it that you're asserting that these results ought to be repeatable in our cultures, in our countries?
I am asserting that because I think when we look at the video, because we were showing a video of, which is produced by CNN, CNN News 18 in India, which I presume is a local branch of the international network. this editor is interviewing a professor and trying to extract information as to why Uttar Pradesh did so well. And I think when we are finished here today, our viewers will come to understand that Uttar Pradesh really didn't do anything that could not be done by others. They just had a different focus and a different commitment to deal with COVID-19 as a disease, as distinct from anything else.
Okay, so just another commentary on the rates, because from looking at the, let us say the 7-day average of deaths per million population, which using Uttar Pradesh as a base, as one, then we see that it's 353 times in the US, 230 odd times in the UK, 814 times in Trinidad, and 83 times in Jamaica. So it seems to me then that Uttar Pradesh is not a wealthy state in India.
No, in fact, it's considered to be a poor state.
Okay, so it's not a wealthy state.
And in fact, I want to say that may be one of the reasons why the government recognized that they had to be so serious about it, because they didn't have a lot
of
have
money.
resources, and if they allowed things to run wild, as they say, it really would get out of hand. Yeah.
Okay, so it seems that it cannot be explained on the basis of economy, except because the wealthier countries, I mean, Jamaica is the poorest of, well, Jamaica and Uttar Pradesh are poor, relatively speaking. We are poorer than Trinidad for sure, I think, and definitely poorer than the US or UK in terms of resources. So Uttar Pradesh and Jamaica are the poor side of these comparison. And yet one has 300 and one has
well, compared to itself,
it's a one, and we have 83 times. But the three states that are wealthier than us and Uttar Pradesh, they have 800 times, 300 times, and 200.
Yeah, it just goes to
so
show.
So it cannot be explained on the basis of economics, is what I'm saying.
No,
purely.
Not at all. In fact, I think that the evidence suggests it's really a matter of leadership, political leadership, the commitment of the political leadership. That seems to be, when we listen to what we're going to be hearing, seems to be a very integral and an important and the substantial issue that how to deal with the pandemic.
And it's certainly not related to vaccination rate, which is the final point I want to make.
Yes.
Because it seems almost conversely related to the vaccination rate. Because Uttar Pradesh and Jamaica are equally vaccinated in terms of rate.
Yeah, about 20%.
And again, we have 83 times there in of cases. And highly vaccinated countries have 300 and 200.
Absolutely. So, as we were saying during the last program, high rates of vaccination are neither necessary. If they were necessary, you couldn't have low rates as Uttar Pradesh does if you're not highly vaccinated. And they're not sufficient. If it was sufficient, then
USA would not have
all countries that have highly vaccinated would have low rates. So vaccinations per se are neither necessary.
High vaccination rates
are neither necessary nor sufficient to produce
full control of the pandemic.
To produce a good effect. Yeah, that's a fact.
So we can look then at the report. Looking at why. What did they do? What did they do to achieve this outcome compared to other countries?
So let's take a look at it for the future.
Good afternoon, everyone. Thanks a lot for joining our digital exclusive. I'm Shivani Gupta, Senior Associate Editor, CNN News 18. And joining me is Professor Manindra Agarwal from IIT Kanpur. He's not only part of the Sutra model, but he has also spearheaded a study on just how Uttar Pradesh was very successful in controlling the COVID-19 pandemic, especially the second wave, which hit it worse than the first one. Thank you, Professor, for joining us. There is a lot of mystification of the fact that Uttar Pradesh, a state which is the most populous in the country and a state which has a very lethargic public health system, traditionally and legacy-wise speaking, was able to manage COVID-19 much better than some of the more advanced and richer states. So does your study demystify that? Why UP was as successful as it was?
Yeah, we have tried to do that. See, this is, as you very rightly said, this was a mystery when we started to us as well. Of course, we were noticing from data that the control, or rather the spread of the pandemic, is getting controlled very well in the state. But what were the reasons behind it? And that's where we contacted the state government with a request that if they can share us with exactly all the details of their steps, the data that they have. We had independently collected a lot of other data. And then we studied and analyzed everything over a couple of months to come to some key conclusions, which shed light on exactly what was done to control this spread and manage it better than many other states.
So obviously the strategy against COVID worldwide, the basic strategy is the same, which is that you test, trace, you treat, and you isolate, you track. So these are the 4 T's that are followed. So what is it that UP did better than others or differently than others, according to your study?
So regarding this generic strategy of test, treat, isolate, there are levels in this. There is one methodology which focuses on symptomatic cases and tests them, and if found positive, treats them. The target there being that control don't allow the serious cases, or rather focus on serious cases and not defocus a little on the other asymptomatic cases. These asymptomatic cases, however, do cause the spread. So an alternate strategy is to do a very extensive testing, going to all nooks and corners, and even trying to catch asymptomatic cases, trying to control the spread, so to speak. So that's we called it the chasing the pandemic strategy, and whereas the other is a targeted testing strategy. And we have now come up with a very good analysis of that, and we can clearly see that UP is the one of the few states that has consistently followed chasing the pandemic strategy. Even Kerala, which started last year with the chasing the pandemic strategy and were quite successful, by the time second wave came, they had switched over to targeted testing strategy. And this chasing the pandemic strategy is something which is not easy to execute, because the effort required is a lot more, and you have to do it for a very extended period of time. And that's where I think the state succeeded, where some others could not.
And also, of course, the sheer size and population of Uttar Pradesh makes it a much more challenging job than possibly other states.
That's true. Also,
so
lack
just
of resources.
Break down the key findings for you. First, when it comes to and lack of resources. So I had also studied the UP model very carefully, speaking to several members of the Team 9 of the Yogi government. And obviously, they had ramped up testing a lot. They had relied on antigen testing, not just RT-PCR testing, even at a time when it was not fashionable to do so. They were providing a lot of medical kits to asymptomatic patients, or just door-to-door, testing and tracking and prevention. They were providing ivermectin when it was not fashionable to do so, and then of course positions on ivermectin have changed over a period of time. If you look at WHO guidelines too. According to your study, how would you break down the findings? What was very successful first in dealing with the pandemic, the disease? I'll come to the livelihood and economy issue later.
So, two major successes, I would say. One was since the decision was taken not to impose a lockdown and instead rely on control measures which do not stop the life. That those measures require to be implemented very well, because otherwise you can't control it. Lockdown is an easy and good way of controlling, but if you don't do that, you have to, wherever there is an outbreak, you have to try to isolate it. And since you can't lock the entire place down, you create micro-containment zones. And these micro-containment zones are very dynamic. In a city, there can be multiple of them. And with time, they will change. So that required everybody to be on their toes in order to get it right. And right they did, because our, again, analysis shows that the contact rate or the spread rate, which is also represented as Greek letter beta, It was 0.6 in mid-April, and that was brought down to 0.3, half of it, by these measures which were implemented towards the end of April. And that resulted in the peak of infection to come down by a factor of 2. And that really matters a lot, because when the peak was at around 35,000 cases a day, already the health infrastructure was overwhelmed. When beds were not available, oxygen was not available. People were in a lot of difficulty. Just imagine if the peak was at 70,000 cases a day. I think it's very hard to even, visualize that kind of a chaotic situation that would have come. So that was one major success. And the second, as I mentioned, is also the phasing the pandemic strategy, being able to successfully implement it over an extended period of time. That really contributed to, averting a disaster which could have happened, particularly in villages.
So by that you mean the large-scale testing that they did, the fact that they went to door.
So
we saw the CNN report.
And we are not saying something that is not true. The CNN individual, this is Shivan Gupta, I hope I pronounced the word name properly, and you can jump in and help me pronounce, and Professor Manindra Agrawal were both saying that they recognized that the data was indicating that Uttar Pradesh was getting a very good result, and they both sought to investigate it, because Shivan, in her own way, Dr. Ms. Gupta, in her own way, sought to investigate it, and then she had Professor Manindra Agrawal come on to say what he found, because apparently they did a study. They went to the government of Uttar Pradesh and said, what are you doing? Collected data and sought to find out why there was such a good result.
So this CNN is a branch of the big CNN that we know, the mainstream media CNN that we know.
I make that assumption because some of these international media houses do have, as it would, networks in other areas.
Because the CNN seems to have more latitude in what they're reporting and what they're investigating than the CNN that comes out of the United States, wouldn't you say?
It does, because CNN coming out of the United States wouldn't touch this. They would not report it. They would not. As is MSNBC and as is all local media houses. They're all ignoring it. It doesn't exist.
Okay.
So the question is why. Yeah?
Okay.
So, she made the point that, everybody does the standard tests, trace, treat, isolate. So why was Uttar Pradesh different? And the professor said that these things occur at different levels. It depends on your commitment to what you want to do.
Okay.
And at most Indian states, not all, because like I said, there are other states that have done quite well, almost as good as Uttar Pradesh. But in many of the other Indian states, and I think around the world, the commitment to test, treat is sort of not so very there isn't that much commitment, because I think they focus on many of the Western countries.
Treat symptomatic patients.
Well, they're not even interested in treating symptomatic people. You haven't seen a lot of things about treating symptomatic people. They're saying vaccinate yourself and all will do well.
And if you're very ill, hospitalized.
If you're ill and becoming blue, if you're white and becoming blue, go hospital and see what can be done. But they're not terribly interested in testing, in an aggressive testing strategy. Nor are they interested in an early treatment strategy.
Okay.
Most Caribbean countries, for example, and places like USA and UK, the mantra is vaccination, and vaccination ought to solve the problem.
Vaccination at one end and hospitalization at the other.
At the other
but
end.
In between, you do not have
So what they were saying is that in Uttar Pradesh, they were very aggressive in terms of testing, tracing, and treating. So whereas in countries elsewhere, people may test and may treat someone who is symptomatic. Uttar Pradesh did more than that. And that strategy of testing people who are symptomatic, and if you're positive, treat. That's they call that targeted. Okay, that's sort of targeted
because
testing.
Someone has flu-like symptoms, you say, let's do a COVID test on it.
That's right.
The COVID test is positive. you may treat them,
You may treat
or you
them.
may not. In
Or
many
you may
cases,
not.
they are not.
That's right.
And then if they get very ill, oxygen levels fall, they get very ill, then they go to hospital.
That's right.
Okay.
So that is the strategy in many places, like in Jamaica and Trinidad and Tobago. So Uttar Pradesh did something else. What they actually did, they call it chasing the pandemic. So they went out and tested people who were even asymptomatic. And if those people were asymptomatic, they treated them nonetheless. And there's a logic to it.
Okay.
You may be asymptomatic, but if you are asymptomatic and infected, the virus is multiplying in you.
And you can
and it is transmitted and spread to other people.
So asymptomatic persons can transmit the virus.
Asymptomatic to transmit.
And treating the infection early reduces the viral load.
That is the assumption.
And reduces your ability to transmit it. So
Absolutely.
this is their thinking.
And they gave out free kits of ivermectin, which is thought to have antiviral properties.
Was that the only thing they
No,
did?
in those kits they also had antibiotics, Panadol, vitamin D, vitamin C.
Okay.
So they were helping the immune system, and the ivermectin was supposed to be taken of the antiviral. So they did not wait
for someone to come to me and say, I have flu-like symptoms, then do a test.
No.
And if the test is positive, then you say, go home and isolate.
Yeah.
If they go home and isolate and they get ill, you say, if you get ill, then go to the hospital.
Yeah.
They did not.
So they had a much more sensible approach. You see it immediately. Because they, like I said, they went out, chased the pandemic. If they found you, even if you're asymptomatic, they treated you, killed the viral load, cut the viral load.
So they did a lot of testing.
They did a lot of random testing. They trained people to go out,
And
do
tests.
random testing, take those free kits of medical medicine with them, the cocktail with them. Anybody who tests positive, you're treated immediately.
So the persons they trained were these medical persons, like nurses, public health workers, and so on.
Whereas I think they did that, but you get the impression that they treated, they trained and educated lots of other persons.
Regular, normal,
Yeah, so they had
non-medical.
They had teams of persons. So they chased the pandemic to bring an end to the pandemic. If even
They did not let the pandemic come to them.
That's right.
So one question that one would wonder is that in as much as in the summer, in the early part of the summer, most of India was having large amounts of deaths.
Yeah.
What do you think, or do you know why they introduced this strategy?
I think it
after?
because
the amount of deaths became so
they recognized that if they let things continue as they were going, the healthcare system would be overwhelmed.
Right.
And I think he was saying at one time, they had as many as, somebody who had an infection would have 6 or contacts or 0.6 contacts, and they were able to cut that down to half. So what they were really doing a preventative approach using early treatment.
So they got serious about it, probably because of the amount of deaths and the risk of overwhelming the hospital.
And remember, it was terrible. It was so bad that CNN and the international media went down.
Being burned.
That's right. They showed out terrible. But like I said, they were careful not to go back once the thing was under control, and they haven't been back since.
So what we see from the video we looked at is that Uttar Pradesh, rather than waiting for persons to get ill, they look for persons who may be infected and not ill.
That's right.
They isolated such persons.
That's right.
And they also treated them.
And they also treated
asymptomatic persons.
They were proactive. They were aggressively proactive.
I think they also spoke to the challenge of isolation.
Yes, but these are poor people living in small houses.
Sometimes their families in one room.
So the one who is isolated, you put him under a tree.
Right. So in fact, like because it's so aggressive were they and so serious about isolating that they said because it's a poor state, they don't have a lot of money, and in some cases, an entire family would occupy one room.
Yeah.
And so what they would do is take the person to be isolated and isolate them outside of that room.
Yeah, so you get fresh air anyway.
You stay under the tree, you get fresh air, you sleep under the tree, and the family stays in the room.
Inside the house,
And so that is to show you how aggressive they were about isolating persons, even with their limited resources.
Absolutely. They were committed to making that there were few cases and few deaths. So they didn't just relax and say, look, all is going to be well, all you need to do is
stay
vaccinate
home, and
yourself.
If you get ill, vaccine.
They
stay
were
home.
very proactive.
The vaccine, if you feel ill, stay home.
Yeah.
And if you get more ill, go to the hospital.
No,
they didn't do that at all.
They didn't do that at all.
They were more prophylaxis, they were more preventative and more aggressive about it.
And prevention is better than cure.
All the time.
It's a standard medicine that earlier
But
you treat something.
This, though. We know
no,
this.
well, we know it. It is taught.
Everybody knows it.
It is taught in medical school, but for some reason, for COVID, no.
It's different.
WHO didn't know it. The CDC didn't know it. The governments didn't know it. So
because we all know that it's better to prevent a stroke than have to treat one. Better to prevent a heart attack than having to treat one. Better to prevent kidney disease than having to treat it. And so for the mantra, prevention is better than cure, is a mantra that applies to all of medicine.
Except for some reason, the authorities that were managing COVID-19 in places like the USA, Jamaica, Trinidad, they don't know those things.
No, I don't agree though. I don't think that they don't know. I think they do accept prevention better than cure, but they focus on one method of prevention, and that was vaccination, which turned out to be a less than efficient means of prevention. So they made prevention almost another word, a synonym for vaccination. They saw vaccination as the only way of prevention, whereas Uttar Pradesh did not see it that way.
But we treat the common cold. The common cold is similar to the COVID-19, except COVID is had much more serious implications.
Right, but I'm saying that other countries tried to prevent COVID, but they only looked at one way of preventing it, that was vaccination.
And they did this, even though we have the knowledge that treatments are a part of medical care, but they chose not to. Anyway, one of the other things that the people in Uttar Pradesh did is to seek to protect the jobs, the economy of the people of Uttar Pradesh. And here's a nice little clip showing how they approached it. They didn't do lockdowns, the kind of lockdowns we did, where you have every whole country shut down and so on. They actually did, small micro.
Well, protection of the economy is a very important facet of managing this thing, and many countries have suffered greatly because of the economic shutdown associated with the pandemic. There are many persons who are earning no money, and their families are really in a dire state because of the economic activity. And there are some members of the private sector in Jamaica, we know, a few, not many, one or two, who have pointed to this, that the total shutdown of the economy has been bad for the country and should be avoided if at all possible.
What I like about the government of Uttar Pradesh, you show that they were
thinking outside the box.
Thinking outside the box, because they were cared for the people of Uttar Pradesh.
Yes.
They didn't want them to have lots of cases, they didn't want them to die, and they didn't want them to go
starve.
hungry.
Yes.
They didn't want them to go hungry.
It was a more holistic way of looking at their population.
They kept thinking, how can we help our people? So they set up micro-containment zones. Let's take a look at
the focus was not on herd immunity. The focus was on caring for the people who lived in Uttar Pradesh.
Or simply vaccinated people, because they did use a lot of vaccines as well. 20% is still a lot, but they were
that was not their focus.
Nothing was off the table.
Right.
They were committed to resolving.
So let's look at the economic protection that they instituted for the people of the state, Uttar Pradesh.
Thousands of villages, they had these Nigrani Samitis that they had formed. Yeah. How did they do that? Could you break that down in any data that you can share with us?
Well, we have collected the numbers. That is, they had more than 70,000 Nigrani Samitis. They had empowered a large number of Asha and Anganwadi workers, given them training, given them incentives, given all the Nigrani Samitis had been given, as you mentioned, a basic medical kit. They were also told that, look, as soon as you even suspect that somebody is ill, you give the medication. Don't worry about tests. Tests will keep on happening. And isolate the person. Now, in a village, the houses are not very large. So you can't say, okay, isolate a person in a room, because perhaps there is only one room. So then the strategy adopted was that they sort of educated everyone that if you fall ill, go stay inside it under a tree outside, because that will help cure, will give you fresh air, will cure you, which is also correct. And that also contained the spread to the rest of the family. So some of these, I would say, rather small but innovative thoughts or ideas were used, which seem to have, it's hard for me to say, or anyone to say which one caused the maximum impact, but I think put together there was a significant impact.
Yes, so we see that the people in Uttar Pradesh, total commitment to their people and their well-being, and that well-being included the economy as well. One of the things that's interesting is that I remember the government of Uttar Pradesh, when they started using ivermectin, they said, listen, we don't have a randomized control trial, which is the gold standard for this thing. We're gonna treat people with it, and then we'll do the science later on. But right now we got to take care of people. And
this was because the drug had such a good safety record. Surely if the drug had dangers, they wouldn't have dared to do that. But because the drug was so safe for so many decades, they felt safe in doing this.
And there is no record that there has been any increase or high levels of side effects from using the medication. So the other thing they said is that, listen, we're going to treat people. We're not going to wait to get back the test results. We'll start treating immediately. So they were aggressive in terms of getting things done. You say, we treat people, you have a symptom, we're not waiting for the result. You have your free medication.
Or if you don't have a symptom and you're test positive.
We treat you, and it's free. Take it, and so on.
And this chasing is something that they were committed to over the long term. It's not something they did for a few weeks and then stop. They chased the pandemic consistently over a long period.
Yes, and the professor said that whereas other states didn't have that commitment, again, I have a feeling it probably because of the bad experience they had before. They know that they don't have the stocks, they don't have the wherewithal to treat. So you got to stop this thing in its tracks before it gets out of hand. So they adopted that approach. We are stopping this before it gets into symptomatic and so on.
We can move to the next video and look in further detail.
Just to mention, as we come to this particular video, to show that what they did also apply to migrant workers. There are a lot of migrant workers coming into Uttar Pradesh, and they put systems in place to deal with that as well, and to deal with them as efficiently as possible. Let's take a look at that.
The scale of their testing and how many persons were involved.
And then the other aspect that UP faced a challenge was, of course, the return of large number of migrant workers, which was, always going to be a challenge for Uttar Pradesh. But they seemed to handle it fairly well, and they actually used it as an opportunity to kind of, skill map the workers that are coming. And of course, it's a long-term strategy to make sure that they don't need to go out of the state to get their jobs once again. But could you break down that strategy and how did that work?
Yeah, so that strategy also is a very interesting one. And I would say thoughtful one. If you right from the decision to actually arrange transport for migrants to come to the state, while it was on one hand, is the move to facilitate their movement, it also allowed the state to control the spread. Because once you know that here are the migrant workers, they are coming, they are all getting deposited at certain locations, where the testing facility, treatment facility, everything is available. So any signs of illness is tackled right there instead of allowing them to go to their villages and perhaps spread there. And as you said that they were also all the centers where they were brought back, in fact, we have some very nice maps in the report which highlights exactly where were the centers, and they were chosen also in a way that corresponding to where the migrant workers, which region from where migrant workers move the maximum. So they set up these maps and centers, map these skills, shared the data of these skills with the respective DMs and the district authorities, and saying that whenever if there is an infra project or some other project which can use these skills, you should just go ahead and employ them. And a lot of migrant workers, if you just look at wave 1 and wave 2, in first wave we had nearly almost 35 lakh migrant workers that returned. In wave 2, not even 5 lakhs came back, which is partly because perhaps the other states where they did not shut down everything, but many states did. At the same time, I think a significant part of that was due to those 35 lakh migrant workers who came back. Many of them never went back to the other state. state.
Went back. And then, of course, the aspect of how all of this was done without completely blocking economic activity. Some form of economic activity, at least as far as industry is concerned, was allowed. Was that not a dangerous strategy to employ? Because while livelihood was important at one time, life is more important than livelihood.
Dangerous strategy, absolutely. Very difficult to execute strategy. If you get it wrong, then you are really roasted, because then a lot of lives will be lost. But to their credit, they managed it very successfully. And if you manage it successfully, there is a payoff. And there is a remarkable payoff, which again, data shows. Unemployment rate in UP in March 2020, before pandemic, was 11%. In June 2021, when the second wave ended in UP, it was 4%. Now, one can quibble with this data that, okay, maybe this is not recorded correctly, this and that, but it's very stark. And even if there is a couple of percentage of difference here and there, it still says that there is a significant drop in unemployment rate thanks to the economy chugging along.
So how was that managed? I mean, how can you drop the unemployment rate by such a big percentage point?
Three things. One,
despite of course the fact, I mean, even if your economy is continuing, it's not like extra jobs were produced.
There were. First, Narega was expanded. And second, there are a large number of infra projects going on currently in the state. Large number of highways, airports, and so many other things are happening. So a lot of workers got employment there. And since none of these activities were stopped, so they could continue and they keep on getting more and more absorbed. Another very interesting data is that nearly 2.7 lakh NOCs were issued during pandemic period for new ventures in the state. So that shows that so many new ventures came up, and every new venture that will come up will take in people and they will employ a bunch of them. So just put everything together and that you get a picture that the economy did not suffer a jolt. In fact, certainly for there could be a possibility that at a high skill level, employment perhaps was not that much available, but at low skill levels there was a lot of opportunities available, and that helped a huge number of people.
Okay.
Well, I hope you're following the video in sequence, because this is the video is arranged from beginning to end of the interview.
So we looked then in that video at how the management or the leaders of Uttar Pradesh manage the challenge of migrant workers. As we said, Uttar Pradesh is a state that depends heavily on workers leaving the state to work in other places and then returning. And so an important part of handling that pandemic and managing it and limiting it and controlling it was managing those migrant workers, the risk posed by the migrant workers. And so that video showed you how they cared for those workers as much as they could, as well as preventing those workers from being a source of COVID for the rest of Uttar Pradesh. One point I should make to our listeners is that you may have heard the Professor Agarwal use the word lakh. Lakh is a kind of unit in India, and it just stands for 100,000. So if somebody says 5 lakh, it means 500,000. So it's just an easy way of using numbers by using the word lakh. It means 100,000, okay? And so the economic activity, as we said again, was not suspended.
In fact, there was actually a decrease in the unemployment, because he said it moved from 11% unemployment to 4% unemployment. Again,
how does that make sense? How could that be?
Because he said all the things that they were building highways, airports, etc. I love the way the government of Uttar Pradesh approaches it. It goes to show that if you wish to, you can think through problems and come up with solutions to deal with it. So they not only maintained low levels, low rates of COVID-19 cases,
They did
low
not-
deaths,
They did
but
not
they also
kick people out of their
they
jobs.
didn't kick people out of their jobs.
Because with the migrant workers, what they did, they moved the control to the migrant workers.
That's right.
So they realized that people would come back into Uttar Pradesh at certain designated locations.
That's right.
They would re-enter the state at
Yeah.
those locations. So they set up testing and
they had
tracing
maps and all sorts of
at
things.
those locations.
At those locations.
And they said, okay, the workers are going to re-enter here.
Yeah.
They're going to be screened and tested and given packets for treatment
Absolutely.
here,
Right
where
here.
they re-enter.
Absolutely.
And then they had maps to say, okay, these workers know these are the skills that they have.
And remember, all the treatment is free.
Treatment is free, and they said these workers have these skills, and they
Yeah.
mapped out the skills.
Yeah.
So they knew the skills, what skills they were coming back into the state
Yeah.
with. And now they would say, where are these skills needed in Uttar Pradesh?
Absolutely.
So they would keep them in the state,
Yeah.
being treated, being
Yeah.
traced,
Yeah.
being followed, and they would map out the skills that they had to match them to the need for the skills within the state.
Yeah.
And so it's very,
No, it's the difference between comprehensive a government, a good government that does good governance, that uses its thinking, that thinks through the processes, thinks through the problems, comes up with solutions that are appropriate for where it is and what it is.
Yes,
And it worked.
absolutely, because you move the resources to where the risk is.
that's
So the migrant workers will come in at this station. At that station, they would have facilities for screening, for testing, for treating,
It's excellent.
and
Excellent.
for mapping their skills.
Ah.
Are you a builder?
Yeah.
Are you a lay roads? Do you what are your skills? And they could then send you to a place in Uttar Pradesh that needed those skills. And they made the point that quite apart from the economy locking down, they actually signed a lot of certificates for new buildings,
Highways,
new
airports.
buildings, new construction
Yeah.
projects to start during that time.
But you see, to do that, like I say, they didn't do the extensive lockdown, the overall lockdown. They did
Focused.
micro management of these containment centers.
Yeah.
So you have to be committed to doing right to use that sort of approach. And they used it.
And you have to care deeply about the people that you're serving to do it as well.
Absolutely.
And when he was challenged by the interviewer, professor said, look, the maybe high level jobs might have fallen off somewhat, but certainly
or didn't increase.
Certainly, but certainly the man in the street, the common man,
The ordinary man.
the ordinary man in the street, their economic activity was protected and their employment actually increased.
So the wealth of the people was protected and the health of the people was protected.
Yes.
Because they had a government that sought to do right by
For
them.
the whole man.
By them.
So, because what is the point of not getting COVID and dying from hunger?
That's right.
That makes no point, no sense
right.
at all. And so Uttar Pradesh looked at the whole man.
Yeah.
Yes.
So in terms of reflection, I would say the government of Uttar Pradesh was committed to handling the pandemic. Its priority was decreasing cases and deaths. Many governments around the world seem to make vaccination the priority.
Well, let's take a pin though. Another facet of Uttar Pradesh that I want to talk about is that what they did in Uttar Pradesh is that they pulled all the resources available to manage the pandemic.
That's right.
For example, they had a problem with oxygen.
Yeah.
We used to see that on in mainstream media
That's
all
right.
the time. Oxygen was running out.
Yeah.
There was deficiency of oxygen.
Yeah.
And so what,
CNN and they love to report that.
yeah. So what they did, they put all their resources, all their brains into how to manage the oxygen supply and demand.
That's right.
And so what they did, they used IT, right?
Yeah.
Well, first of all, the oxygen cylinders have to be carried on these huge trucks,
Yeah.
right? On these huge trains, right?
Yeah.
These trucks. And so and you cannot drive these trucks very fast because oxygen is a flammable
That's right.
liquid. If one of them falls off, you have a big fire, right?
Trouble.
So the trucks could only go at a certain speed. And so what he said they did was, instead of using the trucks, which should only go slowly, they put the trucks on trains.
Put the trucks on trains, yeah.
And
But
the
before
trains.
that, they put the empty cylinders on the Indian Air Force.
Put in, and the
So that the Indian Air Force could
would
get
take
those
the
places to
empties to
places
where
where
they
they
fit.
can be refilled
Right, so
quickly.
they put all the
and then
resources
the
in.
trucks that brought back the full cylinder, they put them on train
On
to bring
trains, so the trains could go fast.
And having done so, the use of the cylinders was monitored.
Yes,
Using
using
various technology,
IT, yeah.
so they can know where
Where's the need greatest? Where's the supply less? And so they could match the supply to the need.
It's
And
the
in fact,
difference
he said that
between-
some places were not using it economically,
That's
and
right.
they were able to intervene
Yeah.
and help them to change.
based on their
So that-
auditing and so on.
Yes, they could audit.
Everything was linked up to some sort of IT system
IT, so they
to
could
make sure that they were used
map
as
out
efficiently as
where
possible.
are these cylinders going? Where are these cylinders needed? How are they being used? And so they brought in the Indian Air Force, they brought in the railway system,
absolutely,
they brought in the IT system to control, to economically
how
control.
could Uttar Pradesh not have good results compared to people who just say, go and get vaccinated?
Right, because they use GPS tracking, you know. They use GPS tracking.
They were serious.
The oxygen
they
tanker.
were serious about doing good by their people.
So supply
and they were thinking of ways to do so.
Supply and demand were managed using all of these resources. All of these resources. The airlines, they were using the trains. Yes, they were using the IT, they were using the GPS to manage supply and demand. So you can go ahead with your...
No, in terms of infection, Uttar Pradesh used the approach of any port in a store. Exactly. No option was off the table. Now, we see in St. Lucia where a doctor who used ivermectin her license was taken away. She had to go to court. I think the court has said that it was unfair or something like that. I don't know
I'm not sure what the final thing is, but she was certainly taken to court.
It is clear that in our jurisdiction, where we are, in the western part of the world, some options were not to be put on the table, and one could assume as to why that was so. This is not the case in Uttar Pradesh. In Uttar Pradesh, all options were on the table, nothing was off the table, and everything, everything.
There was no hostility to any option.
No hostility, as long as you did no harm.
Wow.
Okay.
Right. Okay.
So the other thing that was important, I think, here, I don't know how the media in Uttar Pradesh acted.
Right. That's something to think about.
But clearly,
were they supportive of the state's actions, or were they?
I don't have direct reports, but it doesn't seem to be so. It seemed that all hands were on deck.
Okay.
In our part of the world, the media is clearly is towing the government line. What you have is regime media, as it were. They are acting like Pravda. Pravda operated in the Soviet Union. Whatever the government said is all that. So no media house, to the best of my knowledge, no media house, first of all, in the international media, has brought Uttar Pradesh to the public's attention. The approach that they use has seen to dissect it and share it. No media house has done that internationally. So CNN hasn't done that, MSNBC, etc. And locally, similarly, I don't know of any media in Jamaica, for example, which is where we are, that has sought to bring this sort of information to the public's attention. The media has gone down the route of dividing people into vaccinated and unvaccinated and so on and so forth without any critical analysis of how to approach it.
This is the issue. The media ought to be critical. The media ought to ask, what about this?
Yeah.
Why not this?
Well, they have not even reported it.
Yes, so I think that's a major failing there, because the job of the media is not to just simply say what the government wants you to say. It is to bring truth to the public square, and to bring important questions, and to supply the public with the answers that they need by asking questions. Why not?
Well, we can safely say our local media had no interest in doing
I would give our local media an F.
F minus.
With the possible exception of one written media house, which has given voice to some letters and some critical. So,
But the other thing, where were the medical practitioners? Where are the medical associations? Because this standard is standard in medicine that you do early treatment using repurposed medication in order to assist people to give symptomatic care or whatever. But our medical associations, did they participate? Did they do anything? I haven't heard any of them come out to critique
not as an association, although certainly members of the local medical association did stand up. For example, Dr. Alfred Dawes in Jamaica, he stood up.
Abrams.
He talked about early treatment. Dr. Michael Abrams, who is a vaccine supporter, I must say, in all fairness.
As is that Dr. Dawes as well.
None of them are anti-vaxxers, but they did refuse to take sides in this debate and look at the interests of the patients and look at different options. And even recently, Dr. Abrams wrote an article.
Which I rather like this article in the Gleaner.
Which was entitled Pick a Side.
Pick a Side.
Which he was challenged to do, and he refused to do.
The way he started it, he said, pick a side, she said, clearly irritated by my commentaries regarding the management of COVID-19. My friend of many years, whom I love and respect dearly, was taking me to task about my public remark concerning the pandemic, accusing me of muddying the water, because in her eyes, you're either supposed to be for vaccination or against vaccination.
Like it's politics, like it's one party versus the other rather than health. So I must say that some members of the local media fraternity have been very outspoken about looking at all options, about honest reporting of side effects,
That's right.
and about the limitations of the vaccine. So, yes.
Well, I hope we brought something for you to think about today. That when we run into a problem, it doesn't make sense to take political sides and say, I am for this, I am for that, and everything else in the middle, and put the nation at war with itself. When really what you need is careful thinking about the problem and using our intellect to give the best solution possible for the people of the
Absolutely.
country.
And I want to end with the quote of Dr. Abrams. Very good, excellent article. He said, I see no reason to pick a side. He doesn't support frowning on anyone. He said, I see no reason to pick a side in this predicament. My views are not aligned with those who oppose vaccination, but they do not mirror those who support it.
Yeah.
I am capable of independent thought, very good, and drawing my own conclusions. Excellent. And finally, he says, I support vaccination, but I support a multi-pronged approach to managing the pandemic. People should not be forced to be vaccinated. It is as simple as that. Is it that hard to understand? I say no, it's not that hard to understand. But some persons are willfully ignorant. Yeah. Well, this has been the Issachar Hour. We hope we have provoked some thinking on your part about this pandemic. And
see us again next week.
Yes, you'll see us again. Please send in your questions or comments. We'll be happy to receive them. Thank you so much for joining us today on the Issachar Hour. Uttar Pradesh, what they did and how it worked. Thank you very much.